male reproductive system consists of a pair of testes. Then the ducts include epididymis, vas deferens, ejaculatory duct. There are accessory sex glands like seminal, vesicle, prostate, and bulbourethral gland is there. Then the male urethra and penis forms the male reproductive system, and its main function is production of sperms, production of testosterone. It also helps in deposition of sperms in female reproductive tract. In this slide, we will see the structure of testes. So the testes are paired ovoid organs that lie in the sac of scrotum. Testes develop from intermediate mesoderm of genital ridges. Initially it is present in the abdomen. It is the migrated primordial germ cells of the yolk sac that forms the testis, and later on the testis descends in the scrotum. The testis is covered by three coverings. Outermost covering is tunica vaginalis. Then there is tunica albuginea. So this is the tunica albuginea which covers the testis. Tunica albuginea is thick connective tissue capsule. Inside the tunica albuginea we have the tunica vasculosa. So this is the tunica vasculosa. It lies just deep to the tunica albuginea. Now the tunica albuginea gives septum, connective tissue. Septa arises from the capsule, and this will divide the testis into lobules. So these are the septa which will divide the testis into lobules. Then there is mediastinum testis. It is the thick part of tunica albuginea that gives passage to the vessels and the ducts of the testis. Then within each lobule there is presence of seminiferous tubule. So these are the lobules in which about 1 to 4 highly coiled seminiferous tubules are there, and these seminiferous tubules are again covered, or they are surrounded by connective tissue stroma, and within the connective tissue stroma we have Leydig cells or interstitial cells. Now the terminal part of the seminiferous tubules forms the straight tubule. So the terminal part of seminiferous tubules form straight tubules. They are also known as tubular recti, and they are present near the mediastinum. Then there is a term retitestis. So the straight tubule forms a network in the mediastinum, and this network is known as retitestis. The retitestis gives rise to about 12 to 30 efferent ductules, and these efferent ductules lie at the upper end. Efferent ductules enter into the epididymis. The testis has three outer coverings. Outermost covering is tunica vaginalis, then there is tunica albuginea, and the innermost is tunica vasculosa. So the tunica albuginea forms a capsule which gives fibrous connective tissue septa, and these septa will divide the testis into lobules. So more than 200 lobules are present in the testis, and in each lobule highly convoluted seminiferous tubules are present. So about 2 to 3 seminiferous tubules are present per lobule, and these tubules are about 50 centimeter in length, and they are 150 to 200 micrometer in diameter. And the space between the seminiferous tubule is filled by connective tissue stroma, which contains interstitial cells of Leydig. It has blood vessels and lymphatics. The seminiferous tubules are lined by stratified epithelium. There is stratification because of the spermatogenic cells at different stages of development. Then apart from spermatogenic cell, we have the sustentacular cells or supporting Sertoli cells, and within the connective tissue stroma we have interstitial cells of Leydig. So in the testis we have three cells. The three types of cells in the testis are spermatogenic cells in different stage of development. The second type of cell is supporting sustentacular Sertoli cell, and the third variety of cell which is present in the connective tissue stroma is interstitial cell of Leydig. Now outermost row of nuclei in the seminiferous tubule belongs to sustentacular cells and spermatogonia. So they are present in the basal part. And as we pass or move inwards, we have the spermatocytes, primary and secondary spermatocytes. Then we have the spermatids. Towards the center or towards the luminal part, there are spermatozoa. Within the seminiferous tubule of the testis, there are two types of cells, spermatogenic cells and Sertoli cells. Sertoli cells or sustentacular cells are the supporting cells. They are tall, columnar or pyramidal in shape. They have lightly stained, basally located oval euchromatic nucleus, and these cells rest on basement membrane. Towards its basal part, the spermatogonia are interposed among the sustentacular cells. As we move above, the primary secondary spermatocytes will interpose in it, and towards the apex of the sustentacular cells, which reaches the lumen, in there we have the spermatids. Spermatids are embedded in the apical part of the cytoplasm, and the lateral surface of sustentacular cells are connected by tight junctions that divide the wall of seminiferous tubule into basal compartment and superficial compartment. So you can see in this diagram, the basal compartment has spermatogonia in it, and the superficial adluminal compartment has primary and secondary spermatocytes in it, and towards the apical part we have spermatids in the adluminal compartment. The basal occluded junction will form the blood-testis barrier. So this blood-testis barrier protects the spermatozoa from immune system. Otherwise, newly formed germ cells would be considered as foreign cells, and antispermic antibodies will suppress spermatogenesis. And to avoid this, we have blood-testis barrier formed by the Sertoli cells. Now, within the cytoplasm, basal cytoplasm of the Sertoli cells, we have few inclusion bodies. They are known as Charcot-Boucher's inclusion bodies, and they consist of microfilaments. Then the Sertoli cells will form a junctional complex which will give rise to blood-testis barrier, which isolates the haploid germ cells from immune system. And the Sertoli cells will have follicle stimulating hormone receptors over them, and the FSH will activate Sertoli cells, and it will result in the secretion of anti-Mullerian hormone. And the main function of Sertoli cell is it secretes androgen binding proteins, so it will help to bind and increase concentration of testosterone in seminiferous tubule, which is essential for spermatogenesis. Then it will secrete inhibin. Inhibin will inhibit FSH release by adenohypophysis. Then Sertoli cells will secrete plasminogen activators and transferrin. So these are iron transporting proteins, and the main function of Sertoli cells is to support and nourish the spermatocyte, or to nourish the germ cells. And again, phagocytosis of residual bodies after spermiogenesis, and they form blood-testis barrier and protect spermatozoa from immune system. Then they secrete fructose-rich fluid, which helps in transport of spermatozoa along the tubules. And so these are the main functions of the Sertoli cells. We have seen earlier again, the Sertoli cells also secrete Mullerian inhibitory substance that will suppress development of Mullerian duct in male fetus. Second type of cell present within the seminiferous tubule is spermatogenic cell or germ cells. So these are the cells in different stage of development. The spermatogenic cells are derived from primordial germ cells. They divide, they replicate, they form various stages of spermatogenesis, and they are arranged in stratified manner from basal lamella to luminal area. Means towards the basal lamella we have spermatogonia. Then when we pass inward towards the lumen, there is primary spermatocyte, then secondary spermatocyte. In the apical part or to the luminal surface, there is spermatid, and within the lumen there are spermatozoa. So there is a spermatogenic cycle. It is a wave of germ cell maturation that reverses along the length of seminiferous tubule. And we have lamina propria. It is a thin layer of vascular connective tissue that surrounds each seminiferous tubule, and it consists of 5 layers of myoid or peritubular cells external to the basal lamella of seminiferous tubule, and rhythmic contraction of these myoid cells will help in expulsion of sperms and seminiferous tubule secretions. So far we have seen two varieties of cells present in the testis, that is Sertoli cells and spermatogenic cells. Both these cells are present in the seminiferous tubule. The third variety of cell is Leydig cell. Leydig cells or the interstitial cells are present outside the seminiferous tubule. They are present in the connective tissue stroma surrounding the seminiferous tubule, or they are present in the interstitium. So they are also known as interstitial cells of Leydig. So Leydig cells lie in the connective tissue stroma adjacent to the seminiferous tubule. These cells are large polygonal. They have eosinophilic cytoplasm. They have round nucleus, and they have luteinizing hormone receptors. So luteinizing hormone stimulates Leydig cells for production of testosterone, and the steroid secreting foamy eosinophilic cytoplasm is present, and this is because the Leydig cells have well developed smooth endoplasmic reticulum in it, and its main function is testosterone synthesis. So testosterone is synthesized by the Leydig cell, and the secretion is stimulated by interstitial cell stimulating hormone from the pituitary gland. Interstitial cells help in descent of the testis in fetal life. In puberty, they help in they stimulate the growth of secondary sex characters. They initiate heterosexual drive. They help in the growth of cells of the prostate and seminal vesicle, and they have crystals of Ranke's. So crystal of Ranke are rod-shaped cytoplasmic crystals, and they are present in the Leydig cells. And the activity of the Leydig cell is in the embryonic life. They are active in embryonic life by about 5th month, and till birth they are active. After birth they will disappear. Again, after puberty, the Leydig cells will get activated by gonadotrophin hormone, and it will remain active throughout the life after puberty. Spermatogenesis is the formation of spermatozoa from spermatogonia, and it occurs in 3 phases. First step is spermatocytosis, where there is conversion of spermatogonia into primary spermatocyte. Second step is meiosis, where the conversion of primary spermatocyte into spermatoids occur. And third step is spermiogenesis. It is the process of metamorphosis of spermatoids by which it is converted to spermatozoa. So first step is spermatocytosis. It is conversion of spermatogonia into primary spermatocyte, and again the human spermatogonia are classified into three types based on their appearance or the appearance of their nucleus in H&E staining. So type A dark spermatogonia are those which have ovoid nucleus with dark basophilic chromatin. Type A pale spermatogonia have spherical nucleus with clumsy chromatin and central nucleolus. Type A spermatogonia divide mitotically and they form pale type A spermatogonia and later it divides to type B spermatogonia. The type B spermatogonia on mitosis form primary spermatocyte. Now what is the chromosomal value of primary spermatocyte? It is 46XY. So these are large cells with spherical nucleus and they occupy middle region of seminiferous tubule, that is primary spermatocyte. They have diploid number of chromosome 46XY. So this is first step, spermatocytosis, where the spermatogonia is converted into primary spermatocyte. Now the second step is meiosis. So it involves conversion of primary spermatocyte into spermatid, and the spermatid has 23X and 23Y chromosome. So on meiosis, primary spermatocyte will form secondary spermatocyte. Secondary spermatocyte later undergo meiosis 2 and they produce 4 spermatids. So one primary spermatocyte will produce 4 spermatids and it has 23X 2 pairs and 23Y 2 pairs. So the spermatid contains single strand or it has haploid DNA. Then the third stage is spermatogenesis or spermatid phase. So here there is conversion of spermatid into spermatozoa. It is metamorphosis, and 4 phases of spermatogenesis are: first the Golgi phase. Golgi complex will coalesce and it will form acrosomal cap, and the centriole will migrate to the posterior pole. So cap phase, where the acrosomal vesicles will cover the anterior half of the nucleus and they form acrosomal cap. Then acrosomal phase is the third phase, where the tail or flagella extends and the nucleus condenses and centrioles will modify and they will form flagellum. So there are 9 coarse fibers developing from centriole. It extends into the tail and mitochondria will migrate in the middle piece, and the part of tail covered by fibrous sheath forms principal piece, whereas the distal part is known as end piece of the tail. And then occurs the maturation phase. So most of the cytoplasm of spermatid is shed as Raynaud's residual body. So the Sertoli cell will phagocytose the residual bodies and spermiation occurs, and finally the spermatozoa are released into the lumen of seminiferous tubule. This is known as spermiation. The seminiferous tubules drain into straight tubules and then into the efferent ducts. So the seminiferous tubules will continue as straight tubule. The terminal part of seminiferous tubule is known as straight tubule. They will form the network known as reticestis. Reticestis will continue as highly convoluted efferent ductules, and the efferent ductules will continue with the head of epididymis. So the straight tubule or tubula recti are the terminal part of seminiferous tubule. The proximal part is lined by simple columnar cell and Sertoli cells are present in it, whereas distal part of straight tubule is lined by simple cuboidal cells. Then the reticestis is complex series of anastomosing tubules in the mediastinum, and it is lined by low cuboidal or low columnar cells with single flagella. And the efferent ductules collect the sperms from reticestis. They have 12 to 15 ducts. They are lined by simple ciliated columnar epithelium and they rest on thin lamina propria, and they have circular smooth muscles. Blood Blood-Testis Barrier is a physical barrier between seminiferous tubule and blood vessels. The adjacent walls of the Sertoli cells have junctional complexes that divide the seminiferous wall into two compartments. There is basal compartment and adluminal compartment. The basal compartment is present between basement membrane and junctional complex, and it contains spermatogonia and primary spermatocyte. In some textbook, they have given that basal compartment has only spermatogonia. Then, towards the lumen, we have adluminal compartment, and it contains primary and secondary spermatocytes, and at the apical part of the adluminal compartment, there are spermatids. The primary spermatocyte move from basal to luminal compartment by breakage of luminal junctional complex, and they form a new basal junctional complex. And the main function of blood-testis barrier is that it separates the haploid germ cells from immune system and prevents formation of sperm-specific antibodies. Here we will see the clinical significance of the testis. So the term orchitis means inflammation of testis. Then we have immotile cilia syndrome known as Cartegner syndrome. It is autosomal recessive disorder with impaired ciliary movement. So in case of respiratory tract, it causes abnormal mucociliary clearance, and in the testis, immotile sperms cause male infertility. And a genetic defect of dynein protein, which is essential for the formation of cilia flagella, may also be the cause of immotile cilia syndrome. Then the second term is cryptorchidism. So for normal spermatogenesis, the temperature should be 2-3 degrees Celsius below the body temperature. And in undescended testis, the germ cells cannot undergo cell division due to higher temperature, but the testosterone production by Leydig cell continues normally. Hence, in such cases, some infertile like azoospermia with normal secondary sexual characters due to testosterone is seen. Means in cryptorchidism or undescended testis, there will be azoospermia leading to infertility, but normal secondary sexual characters are seen due to the secretion of testosterone by Leydig cells. And the factors affecting spermatogenesis are dietary factors may be there, then environmental factors, developmental disorders, some infections, then the steroid hormone, toxic agent, ionizing radiations. These are all responsible for affecting spermatogenesis. Epididymis is highly convoluted crescent-shaped structure present along the posterior aspect or posterior surface of the testis. Its length is about 7.5 centimeter, and the sperms acquire motility in the epididymis. The parts of epididymis are head, body and tail. Head is occupied by 10 to 20 efferent ductules, and the body and tail accommodates a single highly coiled duct of epididymis. So the duct of epididymis is lined by pseudostratified columnar epithelium with stereocilia. Means there are two types of cells in the duct of the epididymis: tall principal cells and short basal cell. Principal cells have numerous long modified microvilli known as stereocilia, and their function is absorption of the secretion. And the halo cells are few intraepithelial lymphocytes found in epididymis. Then the basal cells, they are germinative and they are shorter. Then the muscle coat consists of thin layer of circular smooth muscle, and it helps in propulsion of sperm into the epididymis from efferent ductule, and these muscles also help in ejaculation. The function of epididymis is it is the reservoir of sperm. It helps in absorption of excessive fluid secreted by testis, It will phagocytose residual body in defective sperm. It helps in secretion of surface-associated decapacitation factor that coats the sperm, and this factor is removed during capacitation of the sperms. Vas deferens or ductus deferens is the continuation of epididymis. It is a thick walled muscular tube. It extends from epididymis to ejaculatory duct, and it ascends along the posterior pole of the testis in the spermatic cord. And the terminal part of vas deferens is dilated and it is known as ampulla. Histologically, the ductus deferens has three layers: mucosa, muscle coat, and adventitia. So the mucosa, the lumen of the vas deferens is star-shaped because of longitudinal folds of mucosa, and the lining epithelium is pseudostratified columnar epithelium with stereocilia. And the epithelium shows two types of cell. There are tall columnar cells with stereocilia. They extend from basal lamella to the lumen of ductus deferens, and the basal cells are short. They rest on the basal lamella and they act as germinal cells. Then there is lamina propria. The epithelium is surrounded by thin layer of connective tissue which forms the lamina propria. Now the second coat is muscle coat. It has three layers of smooth muscle. Inner and outer is longitudinal and the middle thick coat is circular. And the muscle coat is much thicker than the mucosa. And the peristaltic contraction of muscle layer helps in propulsion of sperms. Then the third and outermost layer is adventitia. It is made up of loose areolar tissue that contains blood vessels and nerves. And the function of vas deferens is it helps in peristaltic contraction of ductus deferens, and it helps in rapid propulsion of sperms during ejaculation. It does not store the sperms. It will help in propulsion of sperms. And in applied aspect, we have vasectomy, that is permanent family planning procedure performed by cutting and reversing the vas deferens at superficial inguinal ring. Seminal vesicle are paired, elongated, highly folded glands with irregular lumen, and they are located at the base of urinary bladder. And it consists of single duct which is about 12 to 15 centimeter in length and 3 to 4 millimeter in diameter, and it is folded upon itself. The duct of seminal vesicle joins with the ductus deferens and it forms ejaculatory duct. If we see histologically, the seminal vesicle has three layers: mucosa, muscle layer, and adventitia. Mucosa is thrown into numerous folds that form crypts and cavities. Lamina propria shows elastic fibers. Lining epithelium is pseudostratified columnar, and lamina propria has loose connective tissue with smooth muscle. Then the next layer is muscle coat or muscle layer. So thin layer of smooth muscles are seen. Inner circular and outer longitudinal layer is there. And tunica adventitia is the adventitious coat is outermost coat. It is thin layer of loose connective tissue. Main function of seminal vesicle is to produce seminal fluid which is rich in fructose. It provides energy for the sperms and it also has prostaglandins in it. It is alkaline in nature, so it helps to neutralize vaginal secretions, and it contains lipochrome pigments in it. Applied importance of seminal vesicle is that in male infertility on semen analysis, absence of fructose suggests either there is congenital absence of seminal vesicle or a portion of duct system. Prostate is the largest accessory sex gland of the male reproductive system. It is dense conical organ. It extends from the neck of urinary bladder and it surrounds the beginning of prostatic urethra. It is enclosed by a thick capsule. There is inner true capsule and outer false capsule. blue capsule is formed by the condensation of fibromuscular fibrous stroma that surrounds the gland, and false capsule is derived from visceral layer of pelvic fascia, and there is space between true and false capsule. It is occupied by prostatic venous walls. Then beneath the capsule there is glandular part, which has 30 to 50 tubuloalveolar glands embedded in the fibromuscular stroma. So the parenchyma has glandular part and stroma, and the glandular part is poorly developed at birth. It proliferates at puberty and degenerates at old age. The glandular tissue is mainly formed by follicles. So we can see in the diagram, the glandular tissue is formed by follicles which are lined by pseudostratified columnar epithelium. The follicles drain into 12 to 20 excretory ducts that open in prostatic urethra. And in the duct, the superficial luminal layer is columnar and the deeper layer is cuboidal. The glands are present in 4 zones. Gland consists of 4 zones. There is transition zone, which surrounds proximal part of urethra and has 5% contribution. Then the second is central zone, which surrounds the ejaculatory duct. It forms 20% of the tissue. The peripheral zone is 70%. It surrounds the transitional zone and central zone and also the prostatic urethra except in front. Prostate is fibromusculoglandular tissue. It consists of 1/4 fibrous tissue, 1/4 muscular tissue, and half of the glandular part is present in the prostate. Prostatic glands are arranged in 3 concentric layers. So we can see in this diagram the 3 concentric layers. Innermost is the mucosal gland. It is simple tubular and it surrounds the preprostatic urethra and opens in prostatic sinus above colliculus. Then the pink colored is the intermediate submucosal glands, and they have less follicles and small ducts. They open into the sinus at the level of colliculus, and the outermost blue colored glands you can see in the diagram, the outer main prostatic glands, they are long branched glands with numerous follicles. They have longer ducts and they open in prostatic sinus below the colliculus, and the ducts will join with the urethra. So the lining epithelium of alveoli is pseudostratified columnar epithelium, whereas the ducts are lined by stratified columnar epithelium. Fibromuscular stroma has smooth muscle, collagen and elastic fibers in it. Also the blood vessels, nerve fibers and lymphatics are present in the fibromuscular stroma or connective tissue of the gland. Then the peculiarity or identification feature of prostate is presence of corpora amylacea or prostatic concretions. These are seen or they are more prominent in old age. So these are concentric lamellated bodies and they have glycoprotein precipitated, and after precipitation gets calcified, they stain pink with the eosin. And these concentric arrangements are visible even under low power microscope, and number of corpora amylacea will increase with increasing age. Then the prostatic urethra is also seen in the slide of prostate. It is lined by transitional epithelium in its upper part, whereas the lower part has stratified columnar epithelium. The main function of prostate is secreting prostatic fluid. It has prostatic acid phosphatase, fibrinolysin citric acid, and prostate specific antigens are present. Then in applied aspect we have 2 main conditions: benign hypertrophy of the prostate and others carcinoma of the prostate. What we have to remember is mainly the benign prostatic hypertrophy affects transitional zone. So the transitional zone is affected in benign prostate hypertrophy, and it is common in old age. As the age advances, the chances of benign hypertrophy of prostate increases, and the enlargement can compress the urethra, leading to urinary obstruction and difficulty in micturition. Then carcinoma prostate is more common in the peripheral zone. Okay, benign is more common in transitional zone, and carcinoma of prostate is more common from the peripheral zone. Penis is the erectile organ of copulation in males. It has root fixed to perineum and body is the free portion. It has three masses of erectile tissue. As we can see in the diagram, there are two dorsal masses known as corpora cavernosa and a single ventral mass is corpus spongiosum. The structure of erectile tissue is corpora cavernosa contains numerous vascular spaces lined by vascular endothelium and it is covered by thin smooth muscle layer. Corpora spongiosa is sponge-like tissue surrounding penile urethra. After that, we have tunica albuginea. It is thick connective tissue sheath that binds these three erective masses together and partially separates the two corpora cavernosa. Then the spaces are in communication with arteries and veins, but normally they are empty. These spaces are filled with blood under pressure during erection of penis. And the outermost layer is skin. So the tunica albuginea is covered by thin layer of connective tissue and skin is devoid of hair. Connective tissue of penis is known as Buck's fascia and it is devoid of fats. The penile urethra is lined by pseudostratified columnar epithelium except at the terminal part where it is lined by stratified squamous epithelium. And near the terminal part, the penile urethra is surrounded by glands of Leydig. These are mucus secreting glands. And the applied importance of penis is erectile dysfunction. If the penile erection is complex interaction of vascular and neurologic consequences. Insufficient erection is caused by psychological or some drug induced or it can be due to some systemic disease also. Blood supply of penis is very important. It has superficial or dorsal artery of penis which branches and perforates the tunica albuginea and joins cavernous spaces. The deep helicine or helicine artery means what? Spiral arteries or twisted arteries. So deeper arteries are spiral and they are responsible for erection of penis. They lie contracted, coiled, spirally twisted when the penis is flaccid. And during parasympathetic stimulation or during sexual course or pelvic splanchnic parasympathetic innervation is also known as nervi erigentis. When it is stimulated, then the arteries are dilated. There is increased flow, blood flow. It causes erection. And the sympathetic stimulus is by superior hypogastric plexus via pudendal nerve. It stimulates ejaculation. So parasympathetic is responsible for erection and sympathetic is responsible for ejaculation.